Imagine this. You've been on the same Medicare Advantage plan for 6 years, low premium, dental included, everything bundled up neat and tidy. You figured you made the smart choice. And then one morning in November, a letter arrives. Your insurance company is leaving your county. Your plan ends December 31st. You have 63 days to figure out what comes next. You set the letter aside. You don't fully understand it. You mean to deal with it after the holidays. That is the moment right there on that kitchen counter that your retirement savings started to disappear. And the worst part? 3 million seniors just like you received that exact same letter, and most of them had no idea what to do either. If that sounds familiar, or if you're on Medicare Advantage right now and wondering if your plan is safe, stay right here, because what I'm about to show you could protect your health and your savings. And most people will never hear this anywhere else. And if this channel is new to you, hit that subscribe button right now. We cover Medicare, Social Security, and retirement money every week in plain English, no jargon, no sales pitch, free always. Here's what you're going to know by the end of this video. You're going to understand exactly how Medicare Advantage really works. Not how it's advertised, but how the money actually flows. You're going to learn about a rule that could lock you out of better coverage forever if you wait too long. And I mean that literally. You're going to hear about a 63-day window that the insurance companies certainly aren't advertising. And I'm going to give you 5 specific things you can do this week to protect yourself. Some of what I'm about to tell you, you won't find in a commercial. You won't find it on the enrollment brochure. But it is in the data, and it's in the federal rules, and you deserve to know it. Stay with me. This one matters. Now, before we get into it, let me tell you where this information comes from, because I want you to trust what you're hearing today. The numbers I'm going to share come from some serious places. MedPAC, that's the Medicare Payment Advisory Commission, a nonpartisan body that answers directly to Congress, released an analysis in January 2026 showing something that should alarm every senior in this country. A February 2026 study published in JAMA, the Journal of the American Medical Association, by researchers at Johns Hopkins and Georgetown University, documented what's happening right now in real numbers. And the Kaiser Family Foundation published a February 2026 report on Medigap Access that I think every person on Medicare Advantage must read. These aren't blogs. These aren't opinion pieces. This is the official data. And I'm going to walk you through it in plain English. Let's start at the beginning, because I think a lot of confusion about Medicare Advantage comes from one simple misunderstanding. Most people think Medicare Advantage is Medicare. It's not. Think of it this way. Original Medicare is like the government-run post office. It's not glamorous, but it works everywhere. It accepts everyone, and it runs on predictable rules. Medicare Advantage is like hiring a private delivery company to do the same job. The government pays that private company to handle your mail, your health care, and they get to set their own routes, their own rules, and their own hours. The government pays them a flat monthly fee for every senior they cover. And here's the thing. That fee goes up if you appear sicker on paper. So the company has a reason to document every diagnosis they can find. More conditions on paper means more money from the government. That's the business model. Now, in fairness, for many seniors, especially healthy ones in their mid-60s who don't use a lot of health care, Medicare Advantage can work just fine. You get dental, vision, gym memberships, prescription coverage, all bundled together, sometimes for 0 premium. That's a real benefit. I'm not going to pretend otherwise. But here's what the commercials left out. As of 2025, more than 34 million Americans, that's 54% of all Medicare beneficiaries, were enrolled in Medicare Advantage plans. That is the first time in the history of the program. that more seniors were in private plans than in traditional Medicare. That's a lot of people whose health care is now managed by private companies, whose goal, by law, is to make a profit for shareholders. And what happens when making a profit gets harder? What happens when the math stops working? We're seeing the answer right now in 2026, and it's not pretty. For years, from 2018 all the way through 2024, Medicare Advantage was as stable as a plan could be. The rate of seniors being forcibly removed from their plans was about 1%. 1%. That means in any given year, you had a 99% chance your plan would still be there next January. Those days are over. According to CMS, that's the Federal Centers for Medicare and Medicaid Services, the forced disenrollment rate jumped to 6.9% in 2025, and then in 2026, it leaped again to 10%. That is a tenfold increase in just 2 years. Think about what 10% means. If you're sitting in a room with 10 people on Medicare Advantage, statistically, one of them lost their plan this year. Not because they did anything wrong, not because they missed a payment, because their insurance company looked at their county and said, this isn't profitable enough anymore. According to the JAMA study from Johns Hopkins and Georgetown, roughly 2.9 to 3 million seniors were forced off their Medicare Advantage plans in 2026 alone. And the Kaiser Family Foundation found that about 13% of seniors enrolled in MA prescription drug plans lost their plan entirely for this year. Why is this happening? Here's the honest answer. During the pandemic years, people stopped going to doctors. They were scared. Hospitals were overwhelmed. So insurance companies collected their premiums from the government, spent very little on actual care, and posted enormous profits. Wall Street loved them. Their stocks went up. Everything looked great. Then the pandemic fear faded. People started going back to doctors and hospitals, often for conditions they'd put off for 2 or 3 years. Suddenly, the insurance companies had to actually pay for care, and they discovered that some counties, especially rural ones, were costing them money, so they left. Insurance companies are businesses. When a business loses money in a location, it closes that location. Your health isn't a factor in that decision. Your zip code is, but wait, there's still a bigger problem coming. And this one could affect you even if your plan hasn't changed at all. Here's something that I think will genuinely surprise you. Something that most people on Medicare, whether they're in Medicare Advantage or traditional Medicare, have never heard. Every senior on Medicare Part B is currently subsidizing Medicare Advantage insurance companies. Let me say that again slowly. Even if you're on traditional Medicare and you've never set foot in a Medicare Advantage plan, you are helping to fund the profits of those private insurers every single month. Here's how it works. MedPAC, the nonpartisan congressional advisory body I mentioned earlier, released their January 2026 report to Congress. They're finding the federal government will pay approximately $76 billion more to cover Medicare Advantage enrollees this year than it would cost if those same seniors were simply on traditional Medicare. $76 billion. That's more money than the entire annual budget of the Department of Education. That's not a rounding error. That is a structural overpayment built into the system. And here's where it comes back to your wallet. Research has shown that those overpayments pushed Part B premiums higher for everyone. Your Part B premium in 2026 is $202.90 per month. The first time it has ever exceeded $200. Every Medicare beneficiary in every plan pays that. And a portion of that increase can be traced back to the overpayments flowing to private insurers. Now, this is a policy debate that smart people disagree on. And I want to be fair about that. The insurance companies and their supporters argue that Medicare Advantage delivers extra benefits that traditional Medicare doesn't, and that those benefits justify higher payments. That is a legitimate argument. But what is not debatable is the number, $76 billion. It comes from a nonpartisan body of Congress, and the Committee for a Responsible Federal Budget projects that if nothing changes, it will total $1.2 trillion in overpayments over the next decade. Now, here's what makes this more than just an abstract policy argument. That money isn't disappearing into thin air. It's going to insurance company shareholders. And some of it, according to MedPAC, comes from a practice called upcoding. That's where insurers document extra diagnoses to make patients appear sicker on paper, which triggers higher government payments. They're estimated to have collected about $22 billion in 2026 through upcoding. Alone, several major insurers, including the largest Medicare Advantage company in the country, are currently under federal investigation for this practice. I know that's a lot to take in, but here's why this matters to you personally, not just as a taxpayer. Because everything I just told you is the backdrop for the most dangerous trap in all's Medicare Advantage. And most seniors walk right into it without anyone ever warning them that trap is coming up next. And I think it's the most important thing I'm going to say in this entire video. Before I show you the trap, quick favor. If you're finding this useful, hit subscribe and the bell icon. Right now, we put out Medicare and retirement content every week, and you do not want to miss what's coming. Now let's talk about the lock-in. Picture a hotel with a gorgeous lobby, free breakfast, beautiful pool, and the price is unbelievable. So you check in, but there's a clause in the contract you didn't read. If you get sick while you're staying there, you cannot check out and go to a different hotel. You can only leave if you pass a health test. And if you've been there more than a year and you've developed any health condition at all, you probably won't pass that test. That is Medicare Advantage. Here is the rule, and I want you to hear this clearly. When you turn 65 and first sign up for Medicare Part B, you have a 6-month window to buy any Medigap plan. That's Medicare supplement insurance without any health questions. No underwriting. They cannot turn you down. They cannot charge you more because of your health history. That is your one golden opportunity, and most people don't even know it exists until it's gone. After that 6-month window closes, in most states, insurance companies can require what's called medical underwriting before they'll sell you a Medigap plan. That means they review your medical history, and if you have diabetes, heart disease, cancer, COPD, a history of stroke, they can legally deny you coverage or charge you so much more that you can't afford it. Now, here's where Medicare Advantage turns into a trap. If you chose Medicare Advantage instead of a Medigap plan when you turn 65, you used up that 6-month window without locking in supplemental coverage. If you stay on Medicare Advantage for more than 12 months and then get sick and then decide you want to switch back to traditional Medicare with a Medigap plan, in most states, you cannot. A February 2026 analysis by the Kaiser Family Foundation found that 90% of Medicare Advantage enrollees ages 65 and older, that is 22.4 million people, would face medical underwriting if they tried to get a Medigap plan today. Outside of a special enrollment window, 90%, and only 4 states in the entire country have laws that say insurance companies must sell you a Medigap plan regardless of your health. Connecticut, Massachusetts, Maine, and New York. If you don't live in one of those 4 states, the lock-in trap is real for you. Let me tell you about the rubber. This is a composite based on real cases documented by KFF Health News. So the name is changed, but the situation is very real. Robert joined Medicare Advantage at 65. Free gym membership, dental, low premium. He was healthy, he was happy, and for 5 years, the plan worked fine. Then at 70, he was diagnosed with type 2 diabetes and early-stage heart disease. His specialists were great, but the prior authorization requirements were getting harder. Every year, he wanted more flexibility. He wanted to see specialists without fighting for approvals. So he decided to switch back to traditional Medicare and get a Medigap plan. He applied to 3 different Medigap insurers. All 3 denied him. Diabetes, heart disease. Denied, denied, denied. Robert is now locked into a private plan that he can't leave. And every year, that plan gets a little tighter, the prior authorizations get a little harder, and the network gets a little smaller, as KFF Health News reported on similar cases. And I'm quoting here, there are a lot of people that say, "I'd love to come back, but I can't get Medigap anymore." Or, "I'll have to just pay a lot more." If you live in 46 of the 50 states, you could be Robert. Now, there is an escape hatch, but it has a very short window and the clock is already ticking for a lot of people watching this right now. Here's the good news. There are specific situations where federal law gives you the right to get Medigap coverage without medical underwriting, even if you've been in Medicare Advantage for years. These are called guaranteed issue rights. The most important one happening right now in 2026 is this. If your Medicare Advantage plan terminates, if the insurance company pulls out of your county, you have a federally protected right to buy a Medigap plan without any health questions. But here's what people get wrong about this window. Most people think the 63 days starts when they receive the termination notice in the mail. It does not. According to Medicare.gov, the 63-day clock starts the day your coverage actually ends, not the day the letter arrives. The day the plan stops covering you. If your plan ended December 31st, 2025, your window may have already closed, and this is not something you can reopen. If you set that letter aside over the holidays, if you meant to deal with it but got busy, that window may be gone. I know that's hard to hear, but here's why I'm telling you this so directly. Because the same situation is going to happen again this October when new plan changes are announced for 2027. And I want you to be ready. So here's what you do. If you get any letter from your Medicare Advantage plan, any notice at all about plan changes, plan terminations, or coverage ending, you treat that letter like it's a check for $50,000. You don't set it aside. You read it that day. You call Medicare at 1-800. Medicare if you don't understand it. And if your plan is ending, you contact a SHIP counselor immediately. There's also a rule called the trial right that I want to make sure you know about. If you joined Medicare Advantage for the very first time when you turned 65, you have a 12-month window to change your mind. If within that first year you decide it's not right for you, you can return to traditional Medicare and buy any Medigap plan, and the insurance company cannot turn you down. No health questions, no underwriting. That window is only open once. And for people who joined Medicare Advantage when they first became eligible at 65, the clock is running. If you're in your first year on Medicare Advantage right now, this is your escape hatch. But there's one more thing I want to show you before we get to the action steps. And this one is going to surprise you. Now, here's what almost nobody tells you. And I think this is the moment where this video earns your share. Everyone says Medicare Advantage is more expensive because you pay more when you use it. That's true, but it misses the bigger point. The real hidden cost of Medicare Advantage is not the one that shows up when you have a bad health year. It's the cost that locks in slowly, quietly over years, until the day you want to leave and discover you can't. Think about it like this. If you put $5 a month into a savings account for 10 years, and then discover the bank's terms, say you can never withdraw unless you're in perfect health, you didn't save money. You parked it somewhere you can never fully access. That $0 premium Medicare Advantage plan comes with a maximum out-of-pocket limit of up to $9,350 in 2026 for in-network services. That is the federal ceiling, and many zero-premium plans sit right at that limit, which means if you have a cancer diagnosis, a hip fracture, a cardiac event, you could owe close to $10,000 in a single year on a plan you thought was free. And the even more counterintuitive truth is this. Even if you've never been on Medicare Advantage, you've been paying for it. Because the overpayments to private insurers that I described earlier, PL push your Part B, premium above $200 for the first time in history. Then there's the prior authorization system. In 2024, Medicare Advantage plans received 53 million prior authorization requests. Over 4 million of them were denied. And here's what almost nobody knows. According to data from the Health Affairs Journal, 57% of those denied claims were overturned when someone appealed. 57%. That means more than half the time, when a Medicare Advantage plan says no to your doctor's recommendation, they're wrong. Or at the very least, they reverse the decision when challenged. But most seniors don't appeal. They see the denial, they feel overwhelmed, and they either go without the care or they pay out of pocket. The insurance company is counting on that. They know that most people won't fight back. And here's the last thing that'll make your jaw drop. That specialist you've been seeing for 3 years, the one who knows your full medical history. According to most Medicare Advantage contracts, the insurance company can remove that doctor from your network at any time during the year. They only have to maintain what the rules call adequate access. Your specific doctor is not guaranteed to stay in network from 1 month to the next. You could call for an appointment in August with the same doctor you saw in March and discover they're no longer covered. Now I've spent this whole video telling you about problems. It's time to talk about what you can do. Here are 5 specific things you can do starting this week. Step 1. If you are in your first year on Medicare Advantage, meaning you joined at age 65 and you've been on it for less than 12 months, you have a trial, right? You can leave. You can go to traditional Medicare and buy a Medigap plan with no health questions. That window closes at your 1-year mark. If you're approaching it, call a SHIP counselor this week. Step 2. If you received any notice in the past few months that your Medicare Advantage plan is changing or ending, check the date on that letter carefully. Count 63 days from the date your coverage ends, not the date on the letter. That is your guaranteed issue window. You may still have time. Call 1-800-Medicare today. Step 3. Every October, your Medicare Advantage plan is required to send you something called the Annual Notice of Change. Most people throw it away. Don't. This document tells you everything that is changing in your plan for the following. Your premiums, your drug coverage, your network, your prior authorization requirements. If your doctors are being removed, this document will tell you. Read it the day it arrives. Step 4. Right now, today, call the main offices of your primary care doctor and your key specialist and ask one simple question. Are you still in network with my Medicare Advantage plan for 2026? Don't assume. Call and confirm. Major hospital systems, including New York Presbyterian, Moffitt Cancer Center, and Lehigh Valley Health Network, dropped major Medicare Advantage contracts in 2026. Your doctor's situation may have changed without anyone notifying you directly. Step 5. Call your free SHIP counselor. SHIP stands for State Health Insurance Assistance Program. It is a free government service staffed by trained Medicare counselors who have no financial interest in what plan you choose. They don't work on commission. They work for you. You can find your local SHIP counselor at shiphelp.org or call 1-800-Medicare and they'll connect you. Now, I want to be straight with you about something before I close, because this channel is about giving you the full picture, not just the alarming parts. Medicare Advantage is not a bad product for every senior. For a healthy 65-year-old with few prescriptions, a tight budget, and no major ongoing conditions, The lower premium and extra benefits can be genuinely valuable. If you're in good health and you live somewhere with a strong network of participating doctors, Medicare Advantage may work well for you. The danger zone is this: staying in Medicare Advantage for years, accumulating health conditions as we all do as we age, and then waking up one day to discover you can't afford the care you need. And you can't get out of the plan without losing Medigap access forever. That's the trap. Not entry, not the early years. The moment your health changes and you want to leave. So if you're a Medicare Advantage and you're healthy and happy, I'm not saying run for the door. I'm saying know the rules. Know your trial, right? Know your 63-day window. Know your annual notice. And know that if your health changes significantly, your options for leaving may narrow quickly. Knowledge is the protection here, not panic. Here's the one thing I want you to carry with you from today. Medicare Advantage is like a rental car with great features. But if you get in a serious accident, you may find out you were never actually covered, and by then, you may not be able to afford to own a real car. The plan that seemed too good to be true may be the one thing standing between you and the retirement security you worked 40 years to build. Look, I know that was a lot, and I know some of what I told you today was hard to hear, but here's what I need you to take away from today's conversation. You are not helpless. The system has gaps, and it has problems, but it also has protections built in specifically for you if you know where to look. The 63-day window, the trial, right? The free ship counselor. These exist for exactly this kind of situation. The people who get hurt are not the ones who stayed informed. So share this video, send it to your brother, your sister, your neighbor who's been on Medicare Advantage for years and never thinks about it. It might be the most useful thing you do for someone you love this year. If you're currently on Medicare Advantage and you're wondering whether you could get out if you needed to, drop your state in the comments below. I read every single one, and I'll let you know what the specific rules look like for where you live. If this video helped you, a subscribe means the world. It tells us to keep making this kind of content free for people who need it. And before you go, one more thing. What I shared today is for educational purposes only. It is not financial, medical, legal, or insurance advice. Medicare rules vary by state and they change every year. Always verify your specific situation with Medicare.gov, your state health insurance assistance program, or a licensed Medicare insurance professional before making any coverage decisions. Thank you for spending this time with me today. You're not behind, you're learning, and that already puts you ahead of most people. Take care of yourself. I'll see you in the next one.